All right, good afternoon, everybody. Thank you for having me. It's great to be back. Sorry, it's me and not BTS. I want to take some time today to explain the timeline of what's happening with vaccines for our youngest kids, for kids under 5, and what parents and pediatricians and Americans should be expecting in the coming weeks. So as you all know, the FDA is currently working through a rigorous and independent scientific process. As part of that, the FDA's advisory committee, VRBPAC, will be meeting on June 14th and 15th. They will review the data submitted by Pfizer and Moderna for their vaccines, and we expect an FDA decision shortly after the advisory committee meeting. And we look forward to this process playing out. Now, as you all know, because we've been through this many times, the FDA authorization is not the final step in the process. Before vaccinations can begin, CDC must also issue its recommendations. If the FDA authorizes the vaccines, the CDC will have its advisory committee meetings, and ultimately the CDC director will make her recommendations. And we expect the CDC to make its dates for its advisory committee meetings public very, very soon. So let's talk about what we know at this moment. We know that many, many parents are eager to vaccinate their youngest kids. And it's important to do this right. And that's what this process has been all about. So as I talk through the process today, I want to be very clear that I am not here to prejudge the outcome of the process. But the administration is hard at work planning all sorts of scenarios based on whatever the outcome is from the process that's playing out. We've been working very closely with states, with local health departments, with pediatricians, family physicians, other healthcare providers, and pharmacies to get ready. We started with the playbook we've used for rollout of vaccines for other age groups. At the same time, we're building this program to meet the specific needs of this specific age group. We expect that the vast majority of these kids will be vaccinated by their primary care providers. Now, if and when FDA authorizes a vaccine, we'll move from planning to execution. So let me highlight a few things of what that will look like. Now, the good news is we have plenty of supply of both Pfizer and Moderna vaccines to start our vaccination program. And we are going to make 10 million doses available to states, pharmacies, and community health centers and federal entities to order initially. Starting tomorrow, states can begin to place their orders. We have asked states to distribute the initial tranche of doses to their highest priority sites, including those serving the highest risk children and hardest to reach areas. And we've also asked them to prioritize sites that can handle large volumes, such as children's hospitals. We've encouraged states and providers to find ways to ensure that parents have access to these vaccines for their kids outside of normal work hours, because we want to make this as easy as possible for working parents and their families. Now, FDA authorization will allow us to start shipping doses. These doses are specifically formulated for these young kids. These doses will be shipped to thousands of sites across the country. So let me go back and think through the timeline with all of you. VRBPAC meets on June 14th and 15th. We expect FDA to make its decision soon thereafter. Once FDA has authorized, if they have authorized vaccines, we can begin shipping. We expect some of the shipments to start arriving in their destination over that long weekend. Remember, Monday is an important federal holiday, and many doctors' offices may be closed. And we can't ship vaccines until FDA has authorized these vaccines. And vaccinations can't start until CDC has issued its recommendations. So we expect that vaccinations will begin in earnest as early as Tuesday, June 21st, and really roll on throughout that week. Now, it will take some time to ramp up the program and for vaccines to be more widely available. And as doses arrive in places throughout the country, more sites will have vaccines, more appointments will become available. And our expectation is that within weeks, every parent who wants their child to get vaccinated will be able to get an appointment. We will, of course, do our part. We're going to continue monitoring. We're going to ship doses out as fast as possible. We're going to make sure that supply is always meeting demand. And we're going to do everything we can to make it easy for providers and parents alike to get their kids vaccinated. So let me just close with a few words about the bigger picture about the moment we're in. It's been a long 2 years. This is the last group of Americans who have not yet been eligible to get vaccinated. But as we think about getting ready to vaccinate our youngest kids, it's worth noting how much progress we've made. 2/3 of all Americans are now fully vaccinated. Close to 1/3 of all Americans are boosted. And highly effective treatments are widely available. As a result, when we look across the country, we see cases rising, nearly 100,000 cases a day, and yet we're still seeing death numbers that are substantially about 90% lower than where they were when the president first took office. Now, we know that COVID isn't over. We still have work to do, but we have made tremendous progress. And what we know is that we've got to keep vaccinating, keep reaching people who have not gotten vaccinated, keep making treatments widely available. Because what we believe is that with science, with hard work, and with resources, we can continue to protect the American people from our oldest to our youngest. So thank you, and I'm looking forward to questions.
All right. Okay. Another question.
Well, what's your expectation on when most kids will be vaccinated? Is it a matter of months? What's your estimate?
So we don't have an estimate of timelines of when most kids will be vaccinated. What we know is that obviously there are a lot of parents who are eager to get their kids vaccinated right away, and they will get vaccinated right away. Within weeks, as I laid out. There are other parents who are waiting to see how things go. And I think what we have seen in the past is that they will come on board as they see their friends and family getting their kids vaccinated. So I think this is a process that's going to take some time, but we want to make sure that we always have adequate supply and access for parents when they want their kids vaccinated.
So I think you are well aware about how much frustration and anger there's been from parents of young children. The fact we were talking about second boosters for much of the population before even this first one was available. I'm a parent of a 4-year-old who got COVID while we sat around waiting for this. And I think one point in all of that really is frustrating, raised a lot of questions for parents, is why the FDA didn't move to hold hearing right away after Moderna applied, why it waited for Pfizer and Moderna. Can you just explain the thinking behind that delay?
So, first of all, I have a 10-year-old, so he's been able to get vaccinated, but I have a lot of friends who have kids under 5. So let me just say I feel the frustration. I certainly hear the frustration. Two things. First of all, the FDA makes these decisions on timelines really based on its ability to review the data, to do a careful analysis, and that's what they've been doing. I think they've done that throughout the entire pandemic. If you look at from the early days of the early adult vaccines through this one, they have moved expeditiously, and they have made the determinations of when they can be ready to evaluate and when they can make a decision. The specifics of it, you're going to have to, I think, ultimately talk to the FDA, but I feel like they have moved very quickly to try to consume and analyze a very large tranche of data from Moderna. And look, at the end of the day, we all want to move fast, but we want to get it right. And that has got to be priority number one, and that's what I think the FDA has been focused on.
On Paxlovid, do you have any information you can share with us on how much Paxlovid has been used so far and how much is left, and whether Congress or whether the U.S. is committed to completing its purchase of the 20 million courses?
I don't have the numbers off the top of my head. What I will tell you is we're getting out about 30,000 prescriptions a day right now. And that's at the end of last week. I don't have this week's data yet. So about 30,000 doses a day. We obviously want to continue to expand access to Paxlovid for any high-risk person who gets infected. We want to make sure they have access to it if they're clinically eligible. The president made a commitment to get 20 million doses, and we remain committed to making that happen.
Thank you. I wanted to ask about your COVID testing program, specifically the one that was launched to order COVID tests at home. Can you talk about what the demand has looked like lately now that we're seeing up and down with cases and different than what we saw around Christmas, and what you're doing to preserve supply? I know that these tests eventually expire. What you're doing to preserve supply should there be a big demand again?
Great question. So we launched that about 2 weeks ago, 3 weeks ago. I can't remember the exact time. The third round of making tests available. We actually saw quite a robust demand for that. I think we've had maybe 17, 18 million households order just in the last couple of weeks. So that on round 3, that's a lot, and it's great, and it means that people are still using these tests. If you've followed me for the last 2 years, you know I'm a huge believer in making widespread testing widely available. I think getting people tests at home is a really important part of that. We feel that when you have cases rising, Americans want tests. We want to make those tests available. We also obviously want to make sure that as we have future, if and or when we have future surges of infections, we will have other tests available for Americans.
Can you also talk about, the president was very big at the beginning of that program on equity, and that these tests were going to be distributed to populations that were underserved in addition to populations that might be more well-connected.
So we've thought a lot about equity in this case, in other areas too, but certainly on tests. Yeah, and so the way we've done this is, I mean, obviously website, but you can make phone calls, which for some people is easier. We've distributed tests to food banks. We've distributed tests to federally qualified health centers. We have a whole series of efforts that we have had to make sure that the testing is getting out through a variety of different channels so that people who may not normally be able to access it in other contexts can get access to tests.
I didn't hear you, or sorry, one last thing. I didn't hear you say about tests that are expiring. I know these tests have a shelf life.
Yeah, so with all these tests, and again, this is a standard issue. Anytime you have new products, initially they have a specific shelf life, and then as you do more testing, you can extend that shelf life. So these companies are working with FDA to look at long shelf life, but obviously we're always thinking about that and making sure that there's plenty of shelf life for these products as they sit in our stockpiles.
Dr. Jha, what was the impact of the Department of Defense?
Can you talk about second booster shots for under age 50? Are there discussions right now about allowing those second booster shots? Are those conversations taking place?
So that's a decision of the FDA and CDC. They're always guided by evidence and data on that. All the data that I have seen, or most of the data I've seen, is in people over 50, really in people over 60. That's where the strongest data are. So I think those conversations are always ongoing, but I think the issue of looking at evidence and making a decision, that's really something the FDA is going to have to think
Where
about.
cases are right now, that second booster shot should be authorized for people under age 50?
That I really do leave that up to FDA to decide based on kind of looking at the evidence. So I think they should be making that decision.
All right, last question, Tyler.
Thank you. Do you feel confident that the U.S. has enough supplies for a potential summer surge? And at this point, what are your current predictions about what might happen in the South in the coming weeks and months?
Supply of
vaccines, antiviral treatments, all the various things that are needed to treat COVID.
So because of prior funding, we purchased a decent amount of both vaccines and therapeutics, and so I'm very confident that whatever happens this summer, we will have enough tools, tests, treatments, vaccines to get us through the summer. The challenge is, and again, I'm less in the prediction business, more in the planning business. As we plan the fall and winter and look at a variety of different scenarios, that's where I start getting very, very concerned. I mean, if you want to ask what keeps me awake at night, it is that we are going to run out of vaccines. We're not going to be able to have enough of the next generation of vaccines. We're going to run out of treatments, and we're going to run out of diagnostic tests, probably in the late fall into winter if we end up having a significant surge of infections. We don't have the resources to buy those things, and those purchases need to be made now. They cannot be made in the fall. So if you're wondering what is it that really worries me, I think we have the tools for the summer. We will not have the tools for the fall and winter unless Congress steps up and funds us.
And based on your modeling that you do in the government and with partners outside of it, what is your sense of what this potential surge might look like, both this summer and then when you warn that supplies might run out in the fall and into the winter?
Yeah, so as you know, there are a lot of different models. They all come up with a variety of different answers. And we really look across all of them, and we try to plan across all the ones that we think are reasonable. There certainly are models out there that suggest that we could have a sizable wave of infections in the fall and winter, especially if we don't have a vaccination campaign in the fall and winter, if we run out of treatments, if we don't have enough diagnostic tests. We could be looking at a more complicated situation. So those are models that we look at, we plan for them. Again, as I said, I generally try not to worry too much about predicting what's going to happen and really focusing on planning for a variety of scenarios. And given what we have in terms of treatments and vaccines and diagnostics, we do not have enough to get us through the fall and winter.
And just one last one on that vaccination campaign you mentioned. Are you preparing that most Americans who are not yet eligible for that third vaccine, they will be encouraged to get a fourth one in the fall? And with that, will there be a new vaccine or formula to adapt toward the newer variants that have emerged in recent months?
So there are about 3 or 4 questions embedded in there, all of which are FDA questions, right? So FDA is going to have to make decisions about, do we formulate a new vaccine? There's a VRBPAC meeting that's going to happen in late June, I think, to look at exactly that question. Based on the data, they're going to make determinations. CDC is going to decide who should get it, who should not. I mean, you guys know the process of how that's going to play out.
From your vantage point at the White House as the coordinator of all these different agencies, what your expectation would be?
I am planning for all of those scenarios. We need to, because again, we don't decide what FDA will decide. We don't decide what CDC will decide. They make those decisions. We need to plan for a variety of different scenarios, including planning for a next generation of vaccines for the fall and winter, which we want to make sure we have plenty of for every American. We will not have enough for every American without additional funding from Congress, but we are planning for those scenarios.
Doctor, do you believe all schools will and must be open this coming fall?
Yeah.
You have to go.
I am for.
He has to go.
Sorry, I'm going to run off. Thank you. Sorry.